Hi, I'm Dr. Lisa Goins with Couture Healthcare, and this video is about pediatric visits. A pediatric visit is a child age from newborn all the way to 18. Now, once you reach 18, they consider you adult. However, various insurances will change that up, and some places will also change that up to where it's from a newborn to 12, or you reach a certain age of the high school years, they'll go ahead and start encouraging you to find an adult provider for the rest of your life. It's very scary for a lot of people when you've been with someone your entire life, and then as an adult becoming a new adult, a young adult, you have to find a new provider. It can be very scary. So as a pediatric visit, one of the expectations is the first visit you'll come, if you're a newborn, then it's mom and dad, grandma, or whoever your guardian is going to bring you in, and we're going to have a visit to where we can see how tall you are and measure your head, make sure your head's growing like it's supposed to, that you weigh the right amount, that you're getting plenty of nutrition so you can grow. And then also mom, dad, guardian, whoever may want to bring extra things with them, such as a diaper in case you go through your first one, and some wipes and things. Also a baby blanket, because you might get chilly. We need to cover you up a little bit while we're examining you. Also don't want to put clothes on you that takes 20 minutes to get you undressed and makes you very unhappy as a child and very frustrating for the parents. So a couple layers, and in the winter time we're going to wrap, so that will be makes it easier for the parent to get you in and out quickly. Now, the other thing that we're going to do is we're going to put you on a scales, and then we're going to weigh you. We'll weigh the scales first with something like a blanket or a sheet of paper or something, and to get a true dry weight is what they call. However, you may pee or have a bowel movement. That's going to change your weight as a child. It's expected sometimes when air hits things, we just let it go as a child. Mom and dad may be a little bit upset, but we'll just go ahead and get you cleaned up, and we'll move on through the visit. And we can also tell by the urine that you're putting out or the stool that you're putting out if you're getting what you need. So stools from breastfed moms are going to look a lot different than bottle-fed moms, and that's to be expected. And that'll show up in your stool. So that's something that new parents are going to need to know. Then we're going to also do a temperature test on you. Here we do one across the forehead. We can do one rectally. That's a core temperature. Usually that is if you get sick, major sick. We definitely want to find out for sure what you have going on, but for a regular visit and a check, it would just be probably across the ear. We try to avoid the ears because those are notorious for ear infections, and that just makes you cry all the more as a child, so we try to avoid that. Now, the next thing that we would do is we would measure the head, make sure it's okay. We're going to see how long you are, make sure that you're growing appropriately. We're going to check your joints. We're going to check your legs and your hips, make sure everything is okay there, that your reflexes are working. That's the crani checks that we do, and that's just different things that we do. We hold you up to see if you can support your head or not at certain ages, and we look for your milestones. So all of this is covered to let mom and dad know that you're growing like you're supposed to, and you're moving like you're supposed to, like rolling over like you're supposed to, you're sitting up like you're supposed to, you're starting to talk. And if not, then we can engage and say, hey, we got some problems here, there might be a delay, or heaven forbid, we've got a genius on our hands, you know. So these are things that mom and dad need to know. And then as you get older, we will do shots. We do shots at the 2, the 4, the 6, and the 8, and the appropriate shots required by the CDC. And shots include things to keep us from getting mumps, measles, polio, lockjaw. These are all things that you will grow healthy. There is also a lot of information on the internet. That is completely up to you how you wish to do that. Couture Healthcare is for vaccines. We do encourage them for reasons because we have had family members that if they'd had the vaccine would have been avoided from polio. So we have a little experience, and so we're for vaccines. Now, the other thing is, your first visit, you probably won't get any vaccines. This is going to be a lot of information on how you came into the world. Was everything okay? Was you preemie? Was you the right weight? Are you having any kind of breathing problems? Any kind of educational instruction to help mom or dad because they're new parents, or maybe how to interact with the fact this is child 2, 3, 4, 5, 6, 7, whatever, and how the rest of the siblings are getting along, if there's any care needs there. Also, any needs with getting paperwork filled out to make sure that there's plenty of food in the house, requirements and things that children need. Later on, when you become 4 or 5 years old, then you're starting to look at maybe 3 Head Start or kindergarten age right there. You start thinking about these things. So there's some shots, some booster shots that you need to get all those done. Then later on, there's shots periodically throughout the school years, through the middle years, the junior high years, and the high school years, and now the high school years requiring a meningitis shot, which is very important because we're having a lot of outbreaks in our area and at the university levels. So we want to make sure kids are prepared and that doesn't end badly for them at their university level. Because we do have some colleges in the Cincinnati and Oxford area where the local kids do go, so that is kind of important. And then it comes to the end of being a pediatric visit, and then you become an adult visit. Now at here at Couture Healthcare, we see from children all the way up to pre-zombie, those we refer. And then also, we can transition over to where you can come and see me without mom and dad. Of course, mom and dad's always welcome. And then we start talking about what we're going to do as a young adult. We make sure you have all your boosters, and we start seeing you on a regular basis for not just sports physicals if you continue in the university level, but work physicals and work permits. And we do those here as well. And then we go on into your adult where we start worrying about your heart. We don't worry so much about the size of your head anymore. It's kind of big enough as you get through high school. You get that diploma, you've earned it. And then we start worrying about your BMI, your weight, and your vital signs. Make sure your heart and your lungs and everything is okay. And any allergies and stuff like that you come across, like going camping and coming with poison ivy, that's a problem. You will just make an appointment for yourself and come in and see us, and we'll take care of it. So that's pretty much a pediatric visit from infant to adult on all different ranges. If you do have any questions, please ask me. More than happy to explain anything. And also any providers that you do see outside of Couture Healthcare will also be happy to explain or educate. Nurse practitioners love to do this. We love to educate, and just give us a chance. We'll be more happy to talk to you about it. And my name is Dr. Lisa Goins. Again, this is Couture Healthcare, and we couture your health. Thank you very much.